Exercise is for young people. That's what many of us have believed for years. It's something we think we either did earlier in life or missed our chance to do. And over time, that belief becomes something we accept without really questioning it. But what if that idea isn't true? What if that belief is actually one of the main reasons people lose strength, independence, and mobility as they age? Today, I want to show you that it's not too late, and that what you do now can make a real difference. You share the same thoughts. I'm too old now. It's too late to start. Or even, if I try to exercise, I might get hurt. And those concerns are understandable. As we get older, we feel different. We move differently. But here's the problem. Those beliefs often lead to doing less and less. And doing less doesn't protect us. It actually makes things worse. The real issue isn't age. It's what happens when we stop using our bodies. When we stop moving regularly, the body begins to change. Muscles become smaller and weaker. Balance becomes less stable. And everyday tasks, things like standing up, walking, or carrying something, start to feel harder. This doesn't happen overnight. It happens slowly over time. And because it's gradual, many people don't notice it until it becomes a real problem. But by that point, it can already be affecting independence. There's actually a name for this process. It's called sarcopenia. Sarcopenia is the gradual loss of muscle that comes with aging, and it starts earlier than most people think, often as early as our 30s or 40s. But here's what's important. It speeds up significantly when we're inactive. In other words, it's not just aging, it's lack of use. And over time, this muscle loss is one of the biggest contributors to frailty, falls, and loss of independence. Denke. Muscle isn't just about strength. It's about independence. It's what allows you to stand up from a chair without help, to walk safely without fear of falling, to move around your home and take care of yourself. When muscle declines, those abilities begin to go with it, and that's when people start relying more on others. So this isn't about appearance. It's about maintaining control over your own life. Now here's the part that most people don't realize. The body can improve at any age. Even in your 70s, 80s, and beyond, your muscles can respond to activity. You can get stronger. You can improve your balance. And you can move better than you do today. It doesn't require extreme effort. It just requires consistent effort. The idea that it's too late simply isn't true. And when we talk about exercise, we're not talking about anything extreme. It doesn't mean going to the gym or lifting heavy weights. It can be simple, walking regularly, using light resistance, or doing balance exercises. The goal is not intensity, it's consistency. Small, regular effort over time makes a big difference. And the good news is, these are things that most people can start right where they are. Many people worry that exercise is risky, but the bigger risk is actually doing nothing. Inactivity leads to weakness. Weakness leads to instability. And that's what increases the risk of falls and loss of independence. So the real danger isn't moving. It's not moving. And the longer that continues, the harder it becomes to reverse. Over time, the difference becomes very clear. Two people can start at the same age and end up in very different places. One path leads to increasing weakness, reduced mobility, and dependence on others. The other path leads to strength, confidence, and independence. And the difference between those two outcomes is not luck. It's the choices made along the way. This isn't about age. It's about action. What you do today affects how you live tomorrow. Every small step matters. Every bit of movement counts. So the question isn't whether you're too old. The question is, what kind of future do you want? And what are you willing to do to get there?